This video is all about the basics of ENT physical examination. First, make sure that the patient is seated comfortably. Then, introduce yourself properly and explain the procedure to the patient. The materials that will be needed will be head mirror, otoscope that will also be used as nasal speculum, 512 Hz tuning fork, laryngeal mirror, tongue depressors, and alcohol swabs. First, I'm going to disinfect my hands. Good morning, ma'am. I'm Tony Annabelle. I'm from CIM and I'm going to inspect your ears, mouth, and throat today. Let's begin with the examination of the ears. Inspect the ears for any deformities and lesions. Then I'll palpate the ears. Please tell me if it is painful. Is it painful?
No, it's not.
So ma'am, next I'll put an otoscope on your ear so that I can check the ear canal. It's a bit of uncomfortable. Please tell me if it's uncomfortable for you. In examining the ear, you need an otoscope. Choose the widest speculum that will fit the patient's ear canal. Hold the otoscope as if you're holding a pencil. The ulnar surface of your hand can rest on the patient's face. The auricle is pulled upward and backward in adults, and in pediatric patients, it should be downward and backward. This is to straighten the ear canal. Check for the ear canal and eardrum. Check for the patency, cerumen, and discharges that is present. The patient has an intact tympanic membrane, no lesions and no discharges seen, patent ear canal on both ears. Ma'am, I'm gonna check your ear, so please tell me if you hear something. The next test is the rubber and test. It is a test for bone and air conduction. I'm gonna put it here, and you tell me if you hear the same thing or the other one is louder or not.
Oh, it's equal.
And how about this one? Can you compare the sounds?
Yes, I hear.
Which one is louder?
The second one.
Equal sounds heard on Weber's test is a normal finding, and air conduction is greater than the bone conduction is a normal finding for your Renee's test. Next is the assessment of the face. This is to assess the facial nerves and facial muscles. You can also check for asymmetries of the face, check for lesions and deformities. Next will be the face examination. Can you wrinkle your forehead, please? Can you smile? Wiggle your nose? Can you tighten your neck? Patient's face is symmetric, facial nerves are intact, and facial muscles are in good tone of movement. Next is the examination of the nose. The examiner should be in front of the patient, set up the head mirror and drop light. The drop light should be set up behind the patient, and the head mirror is on the eye of the examiner opposite the drop light. Once the patient is properly positioned, the examination can already begin. First, inspect the patient's nose and palpate. Is it painful?
No.
This is kind of a bit uncomfortable, so it'll be fast. To visualize the internal structures of the nose, hold the nasal speculum using the dominant hand and insert the speculum blade into the nostril and spread the speculum open once it is inside. Your non-dominant hand can support the patient's head on the chin. Identify the structures inside the nose like the nasal septum and turbinates, and also check for any masses or discharges. When removing the speculum, Keep the nasal speculum slightly open. Repeat the procedure on the opposite nostril. The nasal septum is at midline. There are no masses, discharges, or lesions. Next will be the examination of the oral cavity. Ma'am, I'm gonna examine your mouth. This may be uncomfortable. Please tell me if it is. Okay, so I'm gonna check your teeth, lips, buccal mucosa, hard palate, soft palate, tongue, and can you your frenulum and the floor of the mouth. So the next step is I'll do the posterior rhinoscopy. I'm gonna pull your tongue down. I'll put the laryngeal mirror upward so that I can see the nasopharynx. This is uncomfortable, but I'll try my best to not gag you. Please open your mouth. So there's no bleeding, masses, or discharges. So after your posterior rhinoscopy, I'm gonna do a indirect laryngoscopy. So I'm gonna hold your tongue with a gauze and I'll check your larynx through this mirror. Okay, so this is uncomfortable. Okay, can you pull out your tongue? In indirect laryngoscopy, you should tell the patient to say E and to breathe through the mouth. The vocal cord mobility is normal and there are no lesions or masses noted. So the last part will be the inspection and palpation of the neck. The patient should be in a comfortable position and the neck slightly extended. Inspect the neck for any lesions,
Next, I will inspect your
deformities,
neck.
asymmetry, and masses.
We'll palpate.
Lastly, palpate the thyroid gland and ask the patient to swallow to see if there is an enlargement of the thyroid gland. The neck is supple, lymph nodes are non-palpable, and the thyroid gland is non-palpable. Thank you.